Welcome to our debate today. Today's topic is going to be telehealth technology, and it's going to be presented by Kendra, Angela, Taylor, Alexandra, and Shawana. As stated, our topic is telehealth technology, and our topic is going to cover the effects of how to use this telehealth technology to deliver applied behavior analytics services. As we know, in today's world, between COVID and the increase in use of technology, telehealth has become an increasing topic for debate. A brief description of what we're going to be covering are the positive effects of the use of technology, the negative effects, and the increases of technology across ABA services. First up on our debate is going to be covering the positive effects of HIPAA compliance and client dignity as it relates to telehealth technology.
Yes, when providing telehealth services, the ABA providers ensure client dignity by adhering to all the HIPAA compliant rules. There are various ways they do so, but today I'll highlight three of the main examples. So ABA providers they adhere to HIPAA rules by selecting encrypted software, signing business associate agreements, while also gaining informed consent. So to ensure client dignity when using these telehealth services, they select software that is encrypted. So what is end-to-end encryption? We can begin by playing this YouTube video that explains it pretty well.
End-to-end encryption refers to the process of having encryption done at the endpoint. So on some level, this is related to the end-to-end principle, the idea that rather than having certain services provided within the core of the internet, we push those services out to the end hosts, and they're done by clients and servers as part of their communication pattern. So end-to-end encryption, there are certain links. So if you imagine the internet, we know that there are all of these nodes on the internet that are connected together in a variety of ways. And in certain cases, some of these links may themselves be encrypted, particularly wireless links. So if you've ever connected to a wireless router, here's my famous router diagram, you might have noticed that that router required a password or some sort of key that you had to install. And the reason is that that ensures that the communications between, so let's say that Alice is engaged in some communication with Bob over our network here, and Alice's computer may be connected to this router through some sort of wireless link, and that link itself may be encrypted. And there's good reasons to do that. The main reason to encrypt wireless links is because they're particularly easy to eavesdrop on. So if I go anywhere where there's a wireless router and I have a computer that's configured properly, I can sniff or listen to all the traffic that router exchanges with any clients that are connected to it. That's because the wireless medium that the router uses is a shared medium. I can't do that with a cable. So if I wanted to actually eavesdrop on the cable that runs out of my office and sort of through the building, I would actually have to go behind a wall or go into the ceiling or something, and that would be more complicated. But eavesdropping on wireless communications is quite simple. And so in a lot of cases, wireless routers will have some sort of security protocol in place to try to make sure that people can't decipher the communications that are occurring over the wireless channel. And that's done using standard encryption techniques. End-to-end encryption, on the other hand, would be done. So let's say Alice and Bob are having a conversation. Now, Alice's communications with her router may be protected, but once that message enters the internet, if it's not encrypted end-to-end, the message is being transmitted in the clear over the public internet, and there may be powerful companies or organizations or governments that want to sniff that traffic, want to prevent that, want to observe it, want to store it, want to mine it for various pieces of data. And so just because you're using an encrypted link with your router doesn't mean that the traffic is encrypted all the way to Bob. So end-to-end encryption involves Alice and Bob, or Alice and Google.com, or Alice and Microsoft.com, or the websites that you go to, the various services that you use online, agreeing that we're going to encrypt the traffic at Alice and decrypt it at Bob and vice versa. So any message that Alice sends to Bob, she's going to encrypt it locally. So I'm going to take my message and produce my ciphertext, and I'm going to send that over to Bob, and Bob is going to decrypt it here. So end-to-end encryption refers to cases where the encryption is done by the end hosts that are involved in the transaction. So all of the messages that are exchanged, all the traffic that flows from one part of the internet to the other, contains encrypted data in that case. So once Alice and Bob agree on a way to encrypt their connection, all of the packets that they exchange are encrypted and protected during transit.
So yes, as you can see, above the video shows another visual of how it works. Basically, again, the sender encrypts their message using a special key, and once it passes through the server, it remains encrypted and unreadable. So once the message reaches the receiver, they are the only ones that have the special key to decrypt the message and read it. So ABA providers use this method when sending out emails, but also when it comes to video calls, they use software such as Google Meet. So over here with the purple letters, you can see basically how Google Meet works. You can do one-on-one calls as well as group calls, and the data is all encrypted between your device and your client's device. So all the audio and video is only decoded by the two devices who have that special key. Then moving on to the second point, business associate agreements. So what are business associate agreements? They are simply contracts between the ABA providers and their business associates. So business associates are just third-party providers who perform certain services to the covered party, in this case, the ABA company. So they are typically responsible for creating, receiving, maintaining, and storing the ABA provider's PHI, which is the personal health information. And then these contracts, they allow the business associates to perform their tasks while still following all the HIPAA rules and guidelines. And then lastly, moving on to informed consent. So before beginning any treatment, it's important that ABA providers meet with the clients and their families to go over the specifics about the treatment plan. So this can include the frequency and the duration of the sessions, the treatment strategies that would be used, any equipment needed, and so on. After that, they should definitely go over the benefits and the risk taken when using these telehealth services, so that all parties are aware. And then once these discussions occur, once everybody feels comfortable, ABA providers can bring out a consent form for all to sign. It's important that these consent forms are clear, comprehensive, culturally sensitive, and also include all of the rights and responsibilities for all parties. And then lastly, as we are talking about telehealth, it's very different than in person. So, there are a lot of risks, but for whatever reason, if a situation does occur, it's important that ABA providers have a plan. The first thing being that they immediately notify the clients and their families about any breach, specifically stating what happened with the details, and then taking the necessary actions to resolve any problems.
In summary, for our argument for HIPAA compliance and client dignity as it follows through telehealth technology, we discussed end-to-end encryption and how important it is that these platforms are using end-to-end encryption in order to protect client dignity as well as their services that they're receiving. This access to business associates agreement covers it as a contract between the business and the third party in order to protect clients, and informed consent has helped families and clients feel that their therapy is protected under ethical compliance. Our upcoming conversation will be on the contradictory argument for HIPAA compliance and client dignity.
Thank you, Kendra. Thank you, Taylor, for explaining what end-to-end encryption is. Um, we all would like to believe that our services, aka telehealth services, are HIPAA compliant and our clients' dignity is being respected. Since COVID, there's been a boom of telehealth and we're pushing it as safe, but these companies, the Zoom, Cisco, Amwell, DocMe, the most well-known companies here on my slide, they're ranked by market share, were not created for healthcare services. They were created for video chats and business, less sensitive video sharing. These companies, their marketing will have most believe that without questioning that they do comply with HIPAA compliance and secure our clients' dignity. The BACB Code of Ethics 2.03, protecting our confidential information, states that behavior analysts take appropriate steps to protect the confidentiality of our clients, stakeholders, supervisees, trainees, and research participants. And one would think by using these companies, them saying that they have end-to-end encryption, that they are providing safe service. However, Zoom, according to the FTC, November 9th, 2020, were fined for lying about their end-to-end encryption. The FTC alleged that Zoom maintained their cryptographic keys that allow Zoom access to the content of its customers' meetings, also secure its Zoom meetings with a lower level encryption, which means while we're thinking we're getting end-to-end encryption, we're not. And they have access to look in on sensitive video meetings between a RBT and a BCBA, like toilet training or temper tantrums or videos where our clients are not fully dressed. And we do not know. They did not tell us that they had this access. So we cannot give informed consent or tell our clients, stakeholders, that we're being compromised. Zoom having the cryptographic keys means Zoom has access to what's going on during our video session, which violates the BACB's Ethics Code 203, HIPAA, and Code 3.10, limitation of confidentiality. Says BCBA analysts inform clients and stakeholders a limitation in confidentiality at outset of professional relationship and when information disclosures are required. And the ABA feels BCBAs observes via telehealth. I think I talked about that. And according to the FTC, since 2016, Zoom has represented themselves to have end-to-end encryption on its website, its security guidelines, even on its HIPAA compliant website, that their $200 a month Zoom Health subscription provides the end-to-end encryption. The FTC's allegation report number 24 states, in fact, they did not provide end-to-end encryption for its health subscription or any of their meetings conducted outside of Zoom's connection of their products or their host customer on the customer's own server. And majority of their web servers are maintained in China, so they couldn't provide this. to further go on, the other top companies like Cisco, Amway, DocMe, Teladoc, they use third-party encrypting services, which means that there's more cooks in the kitchen. So we cannot say, hey, we can provide a safe place for our clients using telehealth if we don't even know who all have access to our clients, our video, the encrypting keys. So I believe having a BCBA in person could take some of these cooks out the kitchen and provide a safer service. Thank you.
Thank you for sharing your argument against HIPAA compliance and client dignity. It's easy to hear that word end-to-end encryption and feel safe when you're on a telehealth visit. But as you can see from what Angela stated, is that the Federal Trade Commission is making allegations against these platforms that are supposed to keep us safe and are supposed to let us expand our services, which definitely makes for ethical concerns across access to business associates and makes us feel that an informed consent is not doing its due diligence in this situation. Um, as stated previously, there are many ethical codes to consider when you're on this topic. One of the primary ones that we found was Code 203, Protecting Confidential Information. We'll move on to our next topic of effective services as it relates to telehealth technology.
Okay, so over the past couple of years, there has been an increase in the demand for ABA services for individuals with autism. Unfortunately, there has been limited access to individuals who live in urban and rural areas and who have access to limited or no public transportation available. Living in those areas caused a lot of services to be inaccessible or denied due to the inability to attend services, parent trainings, assessments, and evaluations. Socioeconomic status can also play a part in service accessibility because clients may live in an area with limited services and overall community outreach due to the socioeconomic status of the community as a whole, and the family may not have access to personal transportation. With no means of transportation to be able to commute to the services or events in the community, telehealth services assisted to bridge a gap in receiving and maintaining ABA services. When telehealth services arose in the medical and mental health field, there was an increase in the services in the convenience for access to services, and there was improvements in overall patient outcomes. Although telehealth services has been available for 20 years, when COVID-19 arose in the US, telehealth for ABA became more accessible to all in need. Telehealth services has been proven to be cost effective and accessible to individuals and families in all geographical areas. Using virtual communication will assist with the issues of disrupted services and delivering effective ABA services without affecting the client's routines and previously maintained skills. There are several services that can be implemented via telehealth, including but not limited to diagnostic assessments, early intervention, anxiety interventions, FBAs, communication trainings, and language interventions. Behavior analysts also have the ability to update and maintain behavior intervention plans, collect IOA data, collect FOI data, FOI data, model and explain interventions, update crisis plans, update ABCs, ABC data, and much more. All of this information can be shared with the RBTs who are implementing ABA therapy in person to ensure that the client is receiving the most effective ABA services available. There has been several reported benefits for using telehealth services for ABA. Research has shown that there was an increase in parental acceptance of autism diagnosis and treatment, increased parent satisfaction in services, a reduction in problem behaviors, increased client engagement and attending skills, and increased infidelity for treatment with the professionals working with the clients. As you can see on the graphs on the next slide, there was an increase in both performance with the clients and an increase in independent responding for all participants that utilize telehealth services. Overall, telehealth has been proven to be cost effective, accessible, and an asset to families who live in who have limited access to ABA services. Telehealth continues to assist BCBAs and ABA professionals with maintaining and providing effective ABA services.
In summary, it is very cool to see how telehealth technology has been able to expand and provide effective services through these platforms. Our first point that Shawana had mentioned was increasing services in rural and low socioeconomic areas. This is a big area where services can be expanded to, and we can keep providing for families that may be in more need, and maybe not be aware of our services until telehealth technology came to play. The variety of services that can be provided, as Shawana said, there's assessments, early intervention, a whole variety of services that can be provided through the use of this telehealth. And as studies have shown, in some cases, parent and caregiver involvement can increase, and you can see benefits from children by using these services, which makes for a great argument for the effective services of telehealth. Now let's hear the contradicting argument for effective services.
All right, so in contrary, service delivery may not be effective for all due to many reasons, some in which are due to lack of funding for equipment, lack of internet connection, cultural and societal differences, because not all people really believe in having these services, poses a risk of unprotected data, like Angela stated earlier, and sharing sensitive information over the internet that may not be entirely private due to the end-to-end encryption. There's several studies. There's one by Alnamary in 2015, Barkea 2017, Gudmundsdottir in 2017 and 2018, Lee in 2015, Neely 2020, Weiner and Ingersoll 2015, and they all reported facing problems due to poor internet connectivity and calls being dropped. But in contrast to that, Sammy in 2019 reported that connectivity problems were not did not substantially affect service delivery. However, they reported that financial barriers, as one of the participants dropped out because they were no longer able to afford internet services, because also inflation is currently going on as well around the world. Barkea in 2017 reported ethical challenges due to concerns with data protection and security for sensitive information shared over the internet, which is Taylor's argument for end-to-end encryption as well as Angela's. And then Day in 2018 reported a high dropout rate among parents with lower educational level and argued that predominantly self-directed interventions were more suited for parents with higher levels of education due to probably wanting to take part in that parent training process, as well as completely understanding the concepts of the ABA service delivery if parent training wasn't adequately taught to the parent. And Neely in 2020 listed that preventative and responsive strategies to remedy technology issues would need to happen in order for this to work. These tie into effective services because it also has to do with providing effective treatment as well as addressing conditions interfering with service delivery. If you look at my next slide, there's a map that shows the households with internet access by area and region in 2019 across the globe. And it shows that while Europe has the most internet connection, America, in rural America particularly, there's only 50% from Statista. And that was in 2019. So now that it's 2023, there might be more, but if you look at Africa and then Arab states, they have, as well as in APAC, they have the lowest amount in rural for internet connectivity, which can also pose a risk for effective treatment, because now we're not giving adequate treatment across the globe. So it's kind of a disadvantage on a global spectrum in regards to providing culturally appropriate and socially valid treatment.
In summary, Alexandra makes very good statements how a lack of funding is present, a lack of internet connection, kind of targeting those rural and low socioeconomic status areas, as well as the sensitivity to cultural societies and differences. This does kind of provide unprotected data and sensitive information that could be leaked or could be not protecting our clients. There is a lot of codes that follow this certain topic. Some of them I have listed below, including things like code 2.01, providing effective services, continually evaluating our behavior, change interventions, selecting, designing, and implementing behavior change. There's a lot of codes that can be summarized in this topic. Let's move on to cost effectiveness.
So telehealth ABA services are overall less expensive than in-person services, and they also still provide either similar or improved outcomes. So there was a research study that looked at the outcome costs for implementing these ABA telehealth services. Well, they looked at 3 different delivery models. So these included in-home therapy, the clinic-based telehealth, and also home-based telehealth. This study involved 94 cases of children diagnosed with ASD, but also other neurodevelopmental disorders. So 3 points that I'm going to highlight are the reduction in problem behaviors, treatment acceptability, and reduction in costs. So basically, all the parents were trained to conduct the functional analyses as well as functional communication training to try to help reduce the problem behaviors that they were seeing in their kids. Now, the study found that the mean percentage reduction of problem behaviors was greater than 90% for all 3 of the service delivery models. When talking about treatment acceptability, the parents were given surveys where they could rate how they felt the treatment was, and treatment acceptability was high according to those parent ratings. And then as far as reduction in costs, so the total overall cost for implementing the treatment was less costly for both of the telehealth models when compared to the in-home therapy, which was in person. So the least between the 2 telehealth models was home-based. And then the study also broke up the cost between staff, facility, and family to see that even when you break it up that way, the cost decreased from in-person to telehealth. So we can see this on the next slide in the graph. Here, again, this shows the average weekly functional analysis and functional communication training treatment costs per child. So again, this is per week per child. The first bar shows in-home therapy, the second shows clinic telehealth, while the last one shows home telehealth. And you can just see how the bars are just decreasing. And then I just got a rough estimate of the total cost by looking at these graphs. So in-home therapy is around $710 a week per child. Clinic telehealth would be around $464 a week per child, while home telehealth is around $330 a week per child. So you can basically be saving up to $246 to $380 a week for each child. And like I said, this divides it up by staff costs, facility costs, and family costs. And based on, the shades of black, dark gray, and light gray, you can see that they are decreasing, the lowest being home telehealth. So when we move on to the next slide, this shows that although the telehealth services are cost effective. A lot of ABA companies, as well as the clients' families, they do have concerns of internet funds. Like, how will they afford the internet moving to telehealth? Now, there are programs such as the Affordable Connectivity Program that helps ease the cost of providing, internet. So this was created by the Federal Communications Commission, where they just basically try to ensure that all of the households have, they can afford that broadband, because a lot of, not only, kids that are attending school, but there's parents that also have work, and then it also helps with healthcare, in this case, the ABA services. Um, so there are there is a list of eligibility criteria that you have to meet, but only one member in the household has to meet at least one of the points on that list. So if they do meet it, they can just fill out the application. Once they are accepted, they can select the provider and a plan. Now, the provider has to be one that works with this affordable connectivity program. Um, but then they just select the plan, and the provider will automatically discount that $30. And it is monthly, so it is a little bit of a help. But it's just a great way to try to ease those costs.
In summary, excuse me, Taylor makes a really great argument that lower costs and decreased problem behavior kind of makes that win-win situation. In addition, telehealth treatment has widely been accepted by parents as a mode of ABA services. This can be due to having to stay in the house, maybe they're more involved in treatment. There's a whole slew of benefits that come to the parents with this telehealth. In addition to a huge financial savings, we saw that graph. It was going straight down as the more telehealth you used, or the more of that model you used, the lower the cost of services were. Let's go on to the contradicting argument.
Yes, at first glance, telehealth seems to be a more affordable choice for ABA. Thinking about the cost of running the ABA business, brick and mortar, it is more affordable to use telehealth. In the article that me and Taylor both used, that was published in 2016, they used a doctorate level psychologist at $50 an hour per hour, at 0.25 hours per child, a behavior consultant, $30 an hour, 1.75 hours per child. And they use, the cost included a computer at $2.90 a week, and the internet at $2 a week. They also use Skype, which is not end-to-end encrypted. According to Code 3.5 financial agreement, before beginning services, a behavior analyst must document and agree upon compensation billing practices with their client and relative stakeholders or funders when a circumstance change or needs to be revised. Go to the next slide, please. In 2016, that was the cost. In 2023, this is how much a BCBA at master's level make, $56.76. RBT technician on average makes $21.13. And now that you cannot use Skype, you have to use end-to-end encrypted healthcare. Zoom use $199 per month for internet and their Zoom Health. And that's just for one person. So the BCBA has to pay $199 and the RBT has to pay $199 for this service to be end-to-end encrypted. While you would think that that would be still a little bit cheaper. We haven't gone over the equipment that you would need to include into your price, and the fact that Zoom at any chance or time can change, raise their prices like they did just recently, where this Zoom Health was considered free and now it costs $199. In our code 305, we have to tell our clients what our fees are. And we cannot predict what our fees will be when we have fluctual entities in our pricing. Also, according to 2.07, our BCBA code requires us to implement fees and practices or share information about applicable laws and regulations. We do not know, with the change of what's going on in today's society post-COVID, what all might be included or what all might change. So we cannot ethically say we can do this if we don't know what might change at any given minute. Thank you.
To summarize our argument against cost effectiveness, it does show how some of this research is maybe outdated, or how telehealth has the increased use of it has increased the price of it, which also increases the price of cost of equipment as well as cost of hiring staff. Inflation has really increased. Prices all around us globally that we do need to consider the never ending cycle of things increasing in today's society, that when you are informing parents about financial costs or how much services are going to cost, there could be a negative effect on them. um, as kind of stated by Angela already, we do have ethical codes to consider. Some of the primary ones that we found were code 305 for financial agreements, and then 301, that responsibility to clients. It is kind of in summary of this whole presentation, it is important to remember that though technology is becoming this really prevalent thing in today's society, and it is, we have all these new platforms coming to us, we have the ability to go online or go virtual, that there are some negative aspects to these clients and the people that we serve. And at the root of all of this, it is important that we are abiding by ethics codes and that we are providing the best services for our clients. Thank you for listening to our statements and concerns about this telehealth technology as it relates to applied behavior analytic services. For now, there is arguments back and forth still, and will continue to still be arguments for and against telehealth technology. Thank you.
Thank you.